You know, I have to ask you, just because we haven't talked for over a year, the big thing that's happened in the United States is the healthcare reform. What did you think of the bill?
Well, the healthcare bill is an effort to increase coverage, and it will do that. But people sure spend a lot of time on healthcare without getting at the other big issue, which is the healthcare cost inflation going way ahead of the growth of the economy. And that's a terrible thing, whether it's the health costs that hit the government budgets or that hit the private sector. It's making the U.S. less and less competitive. So there's a huge thing in healthcare that some painful things, some big things need to be done. And I'm worried that now everybody's kind of tired of the topic. You know, some people declare victory, some people are sore. It's a very complex area. I worry that we're going to just let medical cost inflation continue ahead, and that will create huge problems.
But you don't buy the argument that many people made, and we've heard it just recently from Tim Geithner, that within the healthcare bill, there are all kinds of cost containment measures, and you know, we're going to see how they work and then ramp them up. You don't see the beginnings of this bending of the cost curve?
No, absolutely not. The Congress said they were going to cut reimbursement rates. That was not realistic. But if in health, the idea of saying what shouldn't we spend on is very tough politically. And I didn't see anything in that debate about, you know, oh, if you're going to cut back, that's a death penalty. I didn't see anything in there that showed a willingness to get at the core of the issue. You know, if every insurance plan has to stay the way it is, if you always get to choose your doctor, if nothing can be done about end-of-life trade-offs there, you're not going to change this cost increase. But the thing that really makes it look bleak fiscally is that this medical inflation, that we have not changed it. And no, the stuff in the bill I don't think is up to that task at all.
And the only thing that would really change it, isn't it fair to say, is, you can call them what you will, but some kind of panels that look at procedures and say, these ones will not be paid for by the insurance.
That's right. If somebody's 83 years old and wants a knee replacement, that would have to be paid for privately. Or, you know, if the effect of proton therapy is very modest in terms of the extra months you get to live, that would have to be paid for privately. And those are tough decisions. European countries have done better at making those decisions. They've avoided the huge number of specialists that our system has that creates difficulties. Right now, it's as rewarding for a company to invent a chemotherapy drug that costs $200,000 a year and only gains months of life for the people involved. That is as profitable as something that keeps people healthy. And so we have to reorder the priorities of the innovation system to get it working on our behalf. And that's the only way I see us making a change.
But this is a pretty dire situation then, because I mean, healthcare costs are by far the biggest driver of the federal budget. They're going to produce, as you say, a kind of essentially unsustainable fiscal condition.
Yeah, democracies, and particularly U.S. democracy, has dealt with tough problems in the past. And how acute does it have to become? How do you take the complexities of it, particularly where you have many groups that love the current way the money is spent? How do you get that out in front of people when it's a very emotionally charged subject? And if you layer on that the number of centrist politicians we have, or technocratic politicians who really take the time to learn an issue in depth, we have less of those today than in the past, you can get worried about this one. But this is going to rise to the top of the list of important issues. And in the past, everything that's risen like that, the country's come up with a way of dealing with it.
Let's talk about